Let's begin. Query number 46 from Navi Mumbai, Maharashtra. Convincing patients for high-end options such as implants, clear aligners, managing the clinic costs and overhead, and in the end, not having anything in hand. Retreatment cost overhead. So the common question is that convincing the patients for treatment is one thing and pricing correctly is another thing. Even if you are able to convince the patients properly and you don't have anything, you can say, left over with you in terms of profitability, then there is something seriously wrong with your charges. So profit is realized when you cover all those costs, direct and indirect, and still are surplus. If you are looking only at the direct cost, then you are never going to earn much money out of it to get more results. So it is always better that the cost analysis starts from understanding of the numbers. Start assessing what all direct and indirect costs are incurred on you. And as I have given, I'll come back to your B part question afterwards. So as I have given already multiple times, I'm giving it once again. See, if you go to my YouTube channel, just search the word profitable and you will have these videos opening up. There is a whole lot of series which answers your costing questions. How do you know to calculate your cost? And this is you can say, a great benchmark for you as well. Those who are opening up their clinic or those who are in that situation where they can manage their clinic money effectively. And of course, as I said, profitable, there are a lot many videos. If you want a shortcut in that also, go to the channel, just search the word profitability. And that is the way you can have all those 5 parts of videos concised into one part as such. So let me just go back to your question 1B. So retreatment cost overhead. So the basic system I understand from here is that what are the cost overhead, and that I told you how to calculate, how to convey it to the patient and how to do that. The best way is to cover it in your consent form. And of course, whatever they are, how much do you charge for a retreatment? Clear everything beforehand. Clear everything before you start. Don't let the patient assume or presume anything. Because if you make them assume or presume, you are not going to get good results out of it. So unless the patient knows what he's in for, he or she can make an informed choice whether to get it done or whether to not get it done. Just imagine the scenario. हम लोग ट्रीटमेंट स्टार्ट कर देते हैं, कोई बात नहीं, एंड में देख लेंगे काइंड ऑफ एटीट्यूड के साथ. एंड इन द एंड the bargain happens. Sometimes you don't even recover the cost. So what is the fun of doing such a treatment? Absolutely nil. It's rather doing it at cost to cost or doing it at nil cost. It's a better way. We are all under this illusion, majority of us, under this illusion that if we tell the pricing beforehand, the patient is going to run away. The patients don't choose doctors for money alone. They consider the overall value and the package that comes with it. Some doctors are good, doctors do good record keeping. Some doctors, you can say, are very calm and composed with their patients. Some doctors have their own way of managing it. And the patient looks at the overall CX, customer experience. You may be far off from the patient, but the patient will say, नहीं, उस डॉक्टर का डायग्नोसिस अच्छा है, ट्रीटमेंट प्लान अच्छा है, तरीके से काम करते हैं, वेट नहीं करवाते हैं. There are so many things that the patient is going to look into. So even if you are far off, even if you don't have a parking facility, even if you are in the traffic, you can say a highest traffic zone, these things don't matter to the patient. But if you are giving value in bargain, And when the patient is going to choose you, they're going to consider their health first rather than money. The problem in our mindset is that we forget the 4 categories of patients. You're given those multiple times: A, B, C, D. Amazing patients, breadwinning patients, convenient patients, and dangerous patients. A and B are the patients which we want always in our clinic. Convenient patients are nobody's patient. They'll go on hopping from one clinic to another in search of a better bargain. But our own mindset has been, you can say, created like an illusion around us कि नहीं सारे पेशेंट सी कैटेगरी के हैं. पेशेंट हो ना हो, हम लोग सी कैटेगरी के बनते जरूर जा रहे हैं. We are choosing it for our own convenience to attribute the failures of our own to something else. If we lack in certain skills, we blame the competition. If we are not charging optimally, we blame someone charging even lower than us. There are multiple ways. So we have also become C or convenient in giving reasons or excuses. So retreatment, whatever charges are, cover it in your consent form. I hope that answers your query.